Did you ever wonder what was the difference between a physician assistant and a nurse practitioner? Well, today we're going to talk about that. Hi, I'm Sean Del Grego from MedTalkUSA. I'm a doctorate-level physician assistant in family practice. Today, people wonder, when I go to the doctor's office, who am I seeing? Why am I seeing them? What's the difference between the PA and the nurse practitioner? Where's this physician at that people keep talking about? Well, the reality is the physician is there most of the time. Many clinics actually have the advanced practitioner, the PA, a physician assistant, or the nurse practitioner, the advanced practice nurse, registered nurse, that's working there at that clinic, and they even have their own, panel of patients that they take care of. So these individuals are highly trained, advanced practitioners, and are a member of a team, and a lot of times in name only. Now, what do I mean about that? The physician assistant works as a member of a team with the physician, hence the name physician assistant. But the physician assistant is a misnomer. In 1967, the physician assistant was created. The physician assistant, the PA, was meant to be a physician extender. In 2020 and beyond, it's changed a lot. Many physician assistants rarely even talk to their physician that they are working with, the supervising physician, except for maybe every once in a while. There have been several times where I've talked to providers who said, you know what, I haven't talked to my physician since the Christmas party, and it's April. That's not good, because you really need to learn from your physician. But if you've been practicing medicine for 15, 20, 25 years as a physician assistant, most likely you're pretty good. And you've taken your reevaluation, your tests, at least 3, 4, 5 times. So you've been doing it for a while. A physician assistant has to take a test now it's every 10 years. It used to be every 6 years. If you didn't pass the test, you didn't practice medicine. It's called the PAN-RE. It's with the NCCPA. So most PAs are actually quite highly trained with over 2,000 hours of clinical experience before they even graduate from their programs. Nurse practitioners, they usually have between 500 to 750 of clinical hours that they have to log before they can graduate from their programs. The PA could be anything getting into PA school. They could be a business major applying to PA school. A nurse practitioner is usually a registered nurse that has at least a 4-year degree. Well, apples to oranges. Does being an RN really give you the experience you need to really excel? And being something else other than medicine give you any experience to excel? I guess that's why the PA program is at least 2,000 clinical hours versus 750 on the other side. Being an RN, they do get medical experience, but it's not the same experience. Practicing medicine and carrying out orders are two different things. I do believe there are a lot of really, really good nurse practitioners out there, and there's nurse practitioners I want to see because they're that good. But then there's also a lot of weak nurse practitioners out there. The same thing goes with PAs and physicians. But overall, the training that you get, one over the other, it could be damning at times. The physician, there's no denying the fact that the physician is an ultimate expert in his field. They graduate with 4 years of a medical school program. Then they have to do an internship year. And then they do a residency in whatever area they want to do, from pediatrics to orthopedics, family practice, urology, whatever it is. And then they're doing at least 3 to 5 years in that residency program. So you're talking about years of experience versus clinical hours, So there is a difference between the two. But in primary care, do you really have to have all of those hours or years of experience to be able to do the same exact job? And the answer for an experienced physician assistant or even an experienced nurse practitioner, the answer is no. In over 30 states around the country, nurse practitioners can practice with full autonomy, or at least some form of autonomy, meaning they don't need a physician in their food chain whatsoever. Where the PA, it's not like that. In every single state in the union, the PAs have to have a physician in their food chain. And it doesn't matter if they're in primary care or something else. Many physicians or physician assistants actually work in other fields besides just primary care. They can work in urology, orthopedic surgery, dermatology. You'll find PAs everywhere. And many times they have to have some form of training in order to excel in that field. So the difference is quite vast, and we can go into it in greater detail on another episode of MedTalkUSA. But the reality is there is a difference. So I'd like to hear some comments. Maybe we can address those at a later time. And it's always a pleasure, in my humble opinion, that you guys make it matter for me. So please hit the like button, subscribe, leave some comments. Hopefully they're good. If they're not good, I understand. Just be gentle on me. We're just trying to help, and we just want to get the word out of what this person does and what that person does, and the difference between the two. So thank you once again for joining me here at MedTalkUSA.
Panda Del Grego Productions.